Today, I want to talk about sexual disorders in men. Men experience sexual issues on and off, especially a few times in their lifetime. But a lot of time, because of embarrassment or thinking that it will get resolved itself, don't get proper advice or treatment about this problem. So, I want to talk about what are the main problems in men and what are the sexual disorders and what are the causes of these sexual disorders. So, number one sexual disorder is erectile dysfunction. And what is erectile dysfunction? If penis don't get hard or maintain its hardness, it is considered as erectile dysfunction. Number two is premature ejaculation, and that is when discharge of semen happens within a short period of time without satisfying your partner. It is considered as premature ejaculation. Then the third problem is performance anxiety, and that's a very common problem that even before initiating a sexual activity, a person is experiencing negative thoughts and fear about performance, and that impacts on their sexual performance. And number four is overall reduced desire and libido in relation to sexual activity. So these are the four main problems in men, and that affects their relationship with their partner or wife and can then lead to more marital issues or problems. So, what are the main reasons? I think number one is the thinking or thoughts, because the main control is in the brain. And if you start with negative thoughts, with high anxiety, not feeling relaxed, then definitely the result is not good. A lot of time there are issues with confidence, self-esteem, feeling guilty, blaming themselves, or being criticized by the partner or wife, impacts on the emotions and thinking process, and that affects the sexual life with the wife. The type of thinking which can affect a person can be that I will not be able to do it, I'll not be able to satisfy my wife or my partner, and there are things I've done in my life which possibly has affected my sexual health, and feeling guilty about it and negative about it. Hence, it becomes a cycle. And when you have a bad experience, you have negative thoughts, and that impacts on your confidence, and it becomes a vicious cycle, impacting on your sexual life. Then, of course, there are a range of psychiatric illness which can affect your sexual health, which can be anxiety disorders, mood disorder, depression, and other psychiatric illness. Your relationship with your wife is also a very important factor, because if you are not satisfied with your wife, if you are having frequent arguments, if you feel that your wife is not more attractive, or she is her look or appearance is not good, she is aging, then definitely it can affect your sexual life. And it is also important that with the ongoing marital problems, if she criticizes about sexual problems, then it becomes a perpetuating factor, becomes a maintaining factor. It's also important that your environment is good. With the environment, I mean that if you are worried that the kids are there and if someone will come and you don't have the privacy, or if there's a loud noise outside the room, there are other environmental issues, it increases anxiety and hence the performance, sexual performance. Then types of medication you're taking can affect sexual health, or increase alcohol consumption or any substance misuse. Drugs can affect, so that's important. Other medical problems like increased blood pressure, diabetes, thyroid problems, increased cholesterol levels, and other medical problems can also be relevant. And that's why the physician, psychiatrists tend to ask for blood test, for testosterone levels, hormonal levels, to make sure that there's no other physical reasons for it. It's very important that your sleep hygiene is good. It's important that you eat good quality food, healthy intake. Water intake is important, at least 10 to 12 glasses of water. Sunlight exposure, good healthy exercise routine is important. And there are medication which helps. There are nutritional supplements like vitamin C, which increases the blood flow by vasodilation, by dilatation. Other nutritional supplements like zinc, selenium. There are a range of minerals and vitamins which can help. Other medication, psychotherapy, marital therapy, cognitive behavior therapy, and also anxiety management techniques. So, I think the first thing is proper evaluation to see what is the main problem and what can be done, like what can be done to improve this disorder. And it is a very important part of your life. Emotional health, sexual health, uh, is very important. And please make sure that if this is something you're suffering from, please take help and advice. And in most of the cases, there's a right treatment available, and you don't need to suffer from it. My name is Dr. Shafiq Yasin. I'm a psychiatrist, and I hope this video is valuable. And I'll make more videos like these. And please comment and let me know if I can be of any help to you